The following activity is presented by the Stanford Center for Continuing Medical Education. Please visit us at cme.stanford.edu.
Thinking critically, interpreting randomized clinical trials. As clinicians and health professionals, it is important for you to keep up with the medical literature. These studies can range from therapeutic or non-therapeutic interventions for treating or preventing disease and health outcomes in your patients. Only results from studies that are considered valid should be considered for translation to the clinical setting. Through this series, we hope you will learn to identify key methodological features that strengthen the internal validity of a clinical trial and critically evaluate whether the results are valid. These skills will help you translate findings to the clinical setting and help you in counseling your patient appropriately. Concurrently, for those of you interested, proficiency in critical appraisal skills will also translate to improvements in writing and peer review of grants and manuscripts. So let's begin, and we will motivate the discussion with this case. Ms. Brenna Lorenz is a 43-year-old female who comes to your internal medicine office for a routine wellness exam. Her past medical history is notable for gestational diabetes, which fortunately she was able to control her blood sugar levels through diet and exercise and did not require insulin during her pregnancies. She does have a family history of type 2 diabetes. Today, when she comes to you, she reports feeling fatigued and notices that, she's overweight. Her BMI is 28, so she's about 10 to 15 pounds above, the normal weight that she should be. You order a fasting plasma glucose and a hemoglobin A1C. Her hemoglobin A1C values are 5.7%, and a fasting plasma glucose is 98 milligrams per deciliter. As we see on this chart here, she's clearly, would be called a pre-diabetic. She meets those criteria based on the hemoglobin A1C, and it's a little bit unclear what her status would be just based on the fasting plasma glucose. Anyway, you're meeting with Ms. Lorenz today to discuss her results and want to counsel her on what she can do to prevent or delay the onset of diabetes. Specifically, she wants to know what her options are. Are lifestyle changes effective? Are there medications? Are there any other options? So it turns out that the Diabetes Prevention Program trial, which was published in 2002 in New England Journal of Medicine, is something that you happen to find during your PubMed search, and it turns out that perhaps your patient is aware of this study as well. In this particular trial, the aim was to delay the development of type 2 diabetes, or also to prevent it, in persons with impaired glucose tolerance or impaired fasting plasma glucose, such as Ms. Lorenz. This clinical trial had 3 arms. One of the arms actually emphasized modifiable risk factors such as losing weight, as well as promoting physical activity and a better diet. The other 2 arms, one was a metformin group, and the third arm was a placebo group. In this series, we will actually learn how to critically evaluate that paper. And we're going to do this in about 3 steps. In the first step, which is in Module 1, we will review key design components of randomized clinical trials. So we will analyze the concepts of randomization and blinding and why they are important. In addition, we will also look at other features that improve validity of a randomized clinical trial. In Module 2, we will review approaches for analyzing data from RCTs. So for example, how do you interpret a survival curve? How do you interpret a relative risk? What does number needed to treat mean? How are these measures estimated as well as interpreted? And finally, in Module 3, we will demonstrate strategies to critically evaluate a clinical trial. So there in Part 1, we will go through the critical evaluation steps, and we will put it all into practice by critically evaluating this particular paper. And hopefully these steps will translate to any type of paper that you are evaluating that is formally testing a therapy or some intervention with an outcome of, preventing or treating a disease. So I look forward to seeing you back in Module 1 when we will review key design components of RCTs.